Assalamu alaikum. We will talk now about liver disease in pregnancy. This lecture is about some common liver diseases which can occur in pregnancy and their effect on the pregnancy process and the pregnancy its effect on the liver disease. We will talk about cholecystitis. Cholecystitis and gallstone increased during pregnancy. Its incidence is about 0.1% because estrogen increases the cholesterol and supersaturation of the bile. And in addition, the gallbladder, biliary duct, and the smooth muscle of the small intestine, all of them are relaxed because of the effect of the hormone progesterone, which increased in pregnancy, as we all know. So there is risk of more exaggeration or risk of more happening or incidence of cholecystitis. The treatment of this cholecystitis, starting with intravenous fluid, bowel rest, correction of electrolytes, and antibiotics with limitations of oral, especially fatty diet. If there is no response and surgery is indicated, we have to choose the trimester suitable for this condition or for this intervention. And in most cases, we choose the second trimester if the clinical presentation or clinical history of the patient can tolerate waiting till second trimester. And you all know why. This is because the least second trimester is the least incidence of having complication about the pregnancy. And if we can, by using laparoscopic approach, it's better with lesser affection and complication of the pregnancy. This table shows to you the liver diseases that happens in pregnancy. Most liver diseases which are pre-existing, for example, chronic hepatitis B and C, or autoimmune hepatitis or Wilson disease, primary biliary cirrhosis, primary sclerosing cholangitis, cirrhosis from any cause, all of them can present in any time of pregnancy. Okay, and these are a pre-existing disease, doesn't correlate to pregnancy or doesn't caused by pregnancy. We see the patient with these diseases. Liver diseases related to pregnancy, this is due to pregnancy per se. For example, if severe hyperemesis gravidarum, and it mostly happens in the first trimester, may persist for the early second trimester and very seldom reaches to the third one. And this is due to pregnancy complication diseases. Intrahepatic cholestasis disease of pregnancy, and this subject we will talk about it, and it happens in the late second toward third trimester. Acute fatty liver of pregnancy, it occurs in the third trimester. Preeclampsia and eclampsia, and you all know the diagnosis of preeclampsia and eclampsia. This happens after the 20th week of gestation toward the third or during peripartum or postpartum period. HELLP syndrome, it's also a complication of severe preeclampsia and usually occurs in the third trimester during or shortly after delivery. Liver diseases that is coincidental to pregnancy. Coincidental to pregnancy. For example, acute viral hepatitis, this can occur in any time. Any pregnant woman is liable for this acute viral infection. Gallstone, mainly in the second and third trimester, but can occur for lesser incidence in the first one. Budd-Chiari syndrome, which occurs during any time of pregnancy, even the postpartum period. Drug-induced hepatotoxicity, also in the whole trimesters, and sepsis. As we mentioned, the middle part of the table, hyperemesis gravidarum, intrahepatic cholestasis, jaundice of pregnancy, acute fatty liver, preeclampsia, and its complication, these are related to pregnancy. Are these complications or liver diseases in pregnancy are common? The intrahepatic diseases or cholestasis over pregnancy, it occurs in about 0.1%. HELLP syndrome about 0.2 to 0.6%. acute fatty liver is 0.005%. This is very least incidence and this is good. Other diseases can occur in any other incidence. Intrahepatic cholestatis disease of pregnancy. It is a condition characterized by accumulation of bile salts and acids in the liver with subsequent accumulation in the plasma. And this is why occurs there is some enzymatic defects in this lady not to excrete these bile salts. So these bile salts will accumulate in the blood and it will result in jaundice and pruritus. The risk factor for such women is, some says that it is related to the estrogen effect. And that's why we see this complication specifically in the pregnancy and in women using combined oral contraceptive pills. Some says these women have genetic predisposition in having this disease. So this explains why she had a recurrence in the next pregnancies. Some correlates advanced maternal age to this condition. The common symptoms of cholestatic jaundice of pregnancy is, as we see, is jaundice and pruritus or itching in the whole body, tiredness and easy fatigability, and changes in the urine with dark colored urine. Intrahepatic cholestatic jaundice, as we mentioned, is due to the estrogen, which is high hormone status, and this correlates with the past history of cholestatic jaundice with estrogen, or some the genetic predisposition, as we mentioned, on advanced maternal age. Some says also multiparty is a risk factor. The process or pathophysiology, there is high bile acids affecting the myometrial contractility, affecting the uterine muscle contractility, and causing excitation of these contraction and increasing the incidence of contraction. Also, they causes vasoconstriction of the chorionic veins in the placenta, and hence this may result in a preterm delivery, meconium staining of the liquor which reflects state of hypoxia in the fetus, fetal bradycardia and distress, as we mentioned, because of the vasoconstriction of the chorionic placental vessels, and sometimes we may end with intrauterine fetal death and fetal loss. And this fetal loss and complication of the fetus, especially if the bile salts level more than 40 micromole per liter in the blood. The fetal complications correlate with serum bile acids, as we mentioned, and if it is very high, the complication can occur. The cardinal symptoms is jaundice, as we mentioned, total body itching. Investigation, we will send the woman for liver function test. We will see that there is increased alkaline phosphatase, bilirubin, and serum bile acids. And these deoxycholic acid, and cholic acid in the blood. These are the common bile salts in the blood. AST and ALT level, which are the liver enzymes, are mildly elevated. It's not very high elevated. Patient may be symptomatic weeks before the laboratory findings are seen. For any woman with jaundice, pruritus, changes in the color of urine, we should put in mind that the differential diagnosis could be viral hepatitis, gallstone and cholelithiasis, biliary cirrhosis, parasitic diseases, dermatological diseases causing this itching, or metabolic disorders such as chronic renal failure, diabetes, or thyroid diseases. If we saw such lady and we confirm the diagnosis, the next step is to treat her. We will use ursodeoxycholic acid, 500 mg to 1.5 gram daily in divided doses. Usually we advise this treatment to be taken with meals. It relieves the pruritus and improves liver test abnormalities. Others may use cholestyramine or S-adenosyl L-methionine, and sometimes we use steroid dexamethasone. For the pruritus, antihistamine aqueous menthol cream 1% can be applied on the skin. Vitamin K and other fat-soluble vitamin supplementation, for example, vitamin K in a dose of 10 milligram daily from 34 weeks till delivery if we have prolonged PT, because liver is the site where the extrinsic clotting factor is synthesized in. Oral steroids also have been used to relieve the symptoms as we mentioned regarding itching. Usually the symptoms resolved in the postpartum period spontaneously because the cause is as we mentioned, is the pregnancy and its estrogen. So once delivery occurs, there is decrease in these hormones in the body, so the symptoms gradually disappears. Complications in the pregnancy, why we take this disease seriously? Because it may result in fetal death, as we mentioned, spontaneous preterm delivery, and postpartum hemorrhage. The next subject, which is also important, is acute fatty liver.